Okay, go ahead. Now we're recording.
Okay. Quick recap for the recording. Make sure you're logged in. Top right, it'll say you're logged in. If it says you don't have permissions to view something, re-log back in, try it again. Good, just general rule of thumb with our website here. So we're on the home page. We're going to scroll down a bit here, find our different banners. These are some of the most important things that we view that we want to make sure you guys see on a daily basis whenever you're hopping onto our website. And I want to start here with the AEP toolkit. So here we are. This is something I use every single day during AEP and the months leading up to it.
Yeah.
So this kind of houses all of the different carrier resources you might need, some CMS guidelines, some different things like that on here. So I just want to show you guys this really quick. So you'll scroll down past here. You'll see all your different carriers. These are going to go to those carrier resources. So why I'm using this right now as much as I am is because everyone's looking at certs and doing the AEP and want to make sure they get the discounts.
Yeah.
And I wish I could tell you that I knew exactly where these things were on every single portal at all times, but I am not that smart. I am smart to know that you go to the AEP toolkit, and something I always like to do is kind of walk agents through what I'm doing so they can find it later. So let's say I want to do Aetna. I was going to start with Aetna, do my AEP. So you'll click on the carrier logo. It'll pull you to Aetna specific page. On this, it'll get you a link specifically to their portal, show you a little bit about their first looks, their certifications. These are the typical items that you're going to see on here. Some will have more, some will have less, just depending on what the carrier has available and what we can pull. Now, this information is always, you'll see either 2023 or 2024. If it says 2023, it's just because the carrier hasn't released that information. I think there's still a couple of ones lingering on the toolkit that say 23, but just check that out. Look, make sure that it does say the 2024. The portal link should be on here. I always use this, the certification guide. So if you go through here, it'll take you directly to this very nice PDF that will not load at the current moment, but does now, and kind of show you exactly step by step of how to get certified. I won't go through this here. Just wanted to show you that this is kind of one of those resources that is easily available on the AEP toolkit. And I'm going to show you one other carrier before we move on to what else is on here. Let's go to United Healthcare, because theirs is a little more not hidden, but all on their website in different places of where you'll need to go. So they've got their certification guides. You'll notice here they don't have their first looks on the website yet because they're not on Jarvis yet. This year, instead of doing like a normal PDF, UHC is actually going to do it on their website. So it should be a little bit easier to navigate once you're in there to look at your market, but we don't have the information on here because it's not on their website yet. Now this kind of goes into more detail about their certification process, how it works. This came up with like exactly as we got the information. So some of these dates you might be like, well, June 12th was a while ago, Clayton. Well, that's because we put this in May or June right before it happened. But this is good information. It'll tell you what you need to do, what these kind of pieces of information mean. This wheel will be the death of me, but I will click and roll down a little bit more. So here kind of goes through the different things that you need to know, some things that are new. Here's how you get the AEP discount through United Healthcare's portal. Here's how you do it if you're working through NABIP's certification process. So I'm throwing a lot of acronyms and words and letters at you, but I want to show that this is where the information's housed.
Yeah.
This is somewhere that you can go instead of having to try to figure out where it is on the carrier portal itself. Start here. This will help you navigate to the carrier portal like we have here, where there's a link up top here somewhere. There it is. That will get you to the portal, but this can kind of be your other window you have open so you can kind of bounce back and forth to see, well, what do I need to do? What's next on there? Refer back to this. Call us if you have any questions while you're going through that process. This is a really good starting point where 9 times out of 10, when someone's needing help with certifications, it's just getting to the right part.
Right.
So this is kind of where I would say an admin, or if you're doing your own certifications, as you're getting prepared, get this page bookmarked, get the AEP toolkit bookmarked, know where it is on the website. Let me scroll down here. You'll see some general information This is going to be on every single one of these different carrier portals because this is way more general stuff, but they'll have some information about how you can order supplies or pre-order supplies if they have that available. The applications and submissions, I'll go over in just a second. Oh, hold on, we got a question.
We got a question.
How do I make this big?
Click. There we go. I apologize, I missed the beginning. How do you get to this carrier portal page?
Ooh, I'll show you in just 2 seconds. I'm about to go back to that main page where you can get to there. But homepage, scroll down, there's like 4 or 5 banners, AEP toolkit, then I'll show you the next one, Anna. So application submissions, that we got a really good part on the main homepage of that. Scope of appointment, general information. This is the other key point. I'd say if you're taking notes and writing anything down, know that the certifications, how to get there, are on the AEP toolkit, as well as the provider and formulary lookup. This is a huge question we get a ton during AEP, is needing help looking up the formulary, or if that doctor's in network. This will take you directly to, on the carrier's page, I'll see if it'll make us log in or not, but it'll take you directly to on the carrier page where you can look up the formulary or look up the doctor. So here we are, we're going into that. We don't have to navigate through UHC's Jarvis portal to figure out where any of this information is. It's all pulled for you.
Yeah.
We're amazing. We got it right here.
Absolutely. This toolkit was built from the ground up, just of different things with different carriers, that different resources that we saw a lot of people needing during AEP. And because AEP is so busy for everyone, if you're able to bookmark the AEP toolkit and look through there and see if maybe there's a really quick access link, that way you don't have to get on the phone, call us. During AEP, you know, we have more people on the phones, but the wait time might be a little bit longer. It might be easier and quicker and faster for you to just pull it up on the toolkit. Of course, please call us if that's what you prefer to do, but we wanted to make this toolkit super accessible, so that way you're able to just boom, 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 get all those things done. And these are links that we've heard from agents say that they need the most. So,
exactly.
Yeah.
We're taking all these kind of questions. Like I said, on agent resources, you guys are calling in and asking me to find this stuff. I usually am going here myself.
Absolutely. Yeah.
So
yeah.
I just want to show you guys the tools that we use here in-house every single day so you all can use them. I'm not saying don't call me, but I am saying check this out. Make sure that you have this here.
Yeah.
I want you to call me, but I know how much time that takes out of your day versus knowing where this is. But I'm happy to pull that. And let's say that you don't want to take the time to call and do all that. Sadie brought up a good point. We're available. Call us, anything, or pop over here.
Live chat.
Message us on live chat. Say, Clayton, I can't find those certification guides. Where are they? I can send you a quick link so you can go right to that website and get on with your day.
Yes. And it's always a human. It's always someone on agent resources. It's never a robot.
Yes.
So
this part is a robot. The hi there.
Well,
this is prompted.
The actual answers.
Yes. Once you get a type of question,
the things
no more robot.
Yes. We have a robot greeter, and then
yeah, that's just us showing off. Like, yeah, we have a robot, but like
we have a robot, but no big deal.
Okay, so I'm gonna close this out. That is another thing to notice, that you'll see multiple tabs here opening up. When you go to another carrier, it won't have a back option. It's just gonna open up a new tab for you. So you can close this out and it'll take you right back to where we were on the carrier resources. So Anna, you were wanting to know where you found the carrier pages. Once you're on the AEP toolkit, you scroll down a bit and you'll see the carrier resources and certification info. And you just click on whichever carrier you're looking for.
We do have a few questions here. Laura said, you guys are amazing. Thank you so much, Laura. Thanks for being transparent. I used to run a help desk, simple, and we were always available, but also try to teach people how to fish. That's exactly, yeah, teaching people how to fish. A lot of times it's not that we don't want to help you guys, absolutely not, but sometimes the most helpful thing is teaching you how to find it, how to access it the quickest way, because we want you guys to be able to get this stuff as quick as you can. So the AEP toolkit hopefully is something that you guys can all benefit from, and you know, have to spend less time on the phone with us.
Yeah. So because like that's something I've talked to with a couple of agents recently, is I know that I should be able to find this, but could you show me? I'm like, that's exactly what I get paid to
Yeah,
do.
exactly. Sure.
Like, I will love to show you, and I want to make sure that you know that the stuff is available
Yeah,
for you.
exactly. Exactly. Okay, so if appointed to those carriers through another FMO, am I still able to use the toolkit?
You are able to use a toolkit. So to have access to our website, you just have to have a contract with us, and then you get access to everything. We're not going to say, well, you don't have Aetna with us, so we're going to block you from that, because our goal at the end of the day is to take care of as many seniors as possible.
Well, yeah.
Of course, we want to be able to help support you in doing that. So love to have that business with you. But if you don't have it, we don't want to just say, no, you can't get here to this awesome tool
Yeah.
that we have. So definitely, if you've don't have that Aetna contract with us this year, I'll say, start using the toolkit, start looking around, and then if you want our help with anything support-wise that goes along with that, that is where we need to have that contract in-house, just from a compliance standpoint.
Yeah.
I can't call a carrier on your behalf if you don't have that with us.
Right. But these links will work for
The
you
links will work.
if you at least have one contract with us, whether you have that carrier with us or not.
Exactly. Let's see, would those carriers be the ones that would provide the discount on AHIP? Yes. So I would say, I'm looking at this list, I don't know of any of these that don't offer the $50 discount. Major nationwide carriers are going to offer that $50 discount. It's just figuring out how do they do it.
Yeah.
Which typically in the AEP toolkit, luckily, will tell you exactly what steps you need to go through, or will have their own user guide to walk you through and show you where you need to go.
We want to help you get that money, you guys.
Yeah.
We want to help you get that money.
Exactly. And the carriers are giving it to you, so let's give it.
Exactly.
I don't see Florida Blue. They're not on the website, Carol, because we're not contracted with Florida Blue. That's going to be one of those more regional based carriers that we just don't have the contract for. We have Anthem and Blue Cross Blue Cross Blue Shield of Kansas City, because we're here in Missouri.
Yeah.
So we got a lot of footprint there, but the regional contracts get so specific, especially with Anthem, that we would have like 300 Anthem contracts.
Right. Yeah.
And just for us to be able to service that, and some of them, they don't even let FMOs have a top of hierarchy contract for. So some of them, unfortunately, won't be on this website. I can at least try to point you in the right direction if I can help find it, but I'm just not super familiar with that portal, to be honest with you.
Yeah.
Okay, so that's a lot on carriers. Thank you guys so much for the questions. I'm already really enjoying this. Let's see. I just registered on senior marketing specialist, but need to get permission into the toolkit as my employer is already contracted. Sent you an email. Lovely, we'll get that approved.
We got you, Anna.
And again, if you see that you're not getting permissions, but you do have a login to the website, try to log in again.
Yeah, sometimes you have to log in twice. It's a weird little glitch thing, but you know what?
I couldn't remember my password, so I did it beforehand because it definitely kicked me out once too.
Yeah.
Okay, so let's go down a little bit further, because this is what I was talking about with the applications and submissions. So this
still on the toolkit.
Still in the toolkit, yes. This is all still in the toolkit. This thing is huge. It could be a website of its own. So on the application submissions, you'll see here the submission agreement form. So this is for paper contracts or paper applications. If you're wanting to, you can send paper applications into us here. We'll scrub them, make sure everything looks right, and then send it on to the carrier on your behalf. We have an enrollment department. Louise, that many of you might know if you've sent those applications, is a superhero, especially during AEP. But she does have a form that she needs you to sign first. So you have to do this once a year, but it's just saying that you're giving us the ability to look at this information, since it is drawn blank on the term where you can't view
HIPAA?
it. HIPAA, that's it. HIPAA, bing, bing, bing. So HIPAA information, it just gives us the ability to look at the information to help scrub that application with you. And then that's once a year. We're coming out with the 2024 form very soon. It'll be on there. But this is something that's every single application needs this application fax cover sheet. I'm going to go ahead and open this up so you guys can see it and not be terrified by it, because fax cover sheet in my world is scary. But this is easy. Just put your writing number. That can be your NPN, agent writing number. Put your NPN, application name. Throw this information on there. This is the email that you'll fax it over to or email it to. Fax at smsteam.net. Here's the different fax numbers. Kind of get you a couple of disclaimers about what's going on with that. You will receive some kind of notification that we've gotten that information. And if they're needing anything after they've scrubbed it, Louise and her team will reach out to you. I love this. If you're doing paper applications, please, 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 if you've got this is one that you have to have that carrier with us to do anything with it. But if you've got that carrier with us, you're filling out a paper application, I highly recommend sending it over to our team. We can scrub it and take a little bit of that admin work away from you guys, where you don't have to worry about, okay, well, I don't know if this is right. The carrier will get back to me. They'll get back to us and we'll notify you. So you can continue on with your selling process.
One less thing you have to worry about.
Yeah, exactly. And then the last little bit, if you want to send it through a secure email, you can click this link and it will take you directly to that. I'll go over a little bit of Medicare Center a little bit later. I don't want to do a full deep dive into Medicare Center. We've got plenty of trainings on that, but we'll circle back to Medicare Center. It's just, here's another place to access it. Now, this, you'd be shocked if I told you this is where the meat of the AEP toolkit is, because this is what a lot of our agents are looking for. If they're not looking for certifications or portals or wherever they're looking for on the carrier side of things, this is where they're going. This has a lot of different information, so I'll start with the presentation and appointment materials. This will go into different worksheets, different things that you can send to your clients either before AEP starts or after October 1st. And it's handy dandy because it will tell you if you can send it to clients on or after October 1st, or if these are just appointment materials. So let's look at some of the appointment materials. I want to show you guys this. For time's sake, I won't show you every single one of these, but got some really nice summary worksheets that I wanted to show you, especially for the MAPD side. So this is something that you could print out, have with your information typed in here, and go through this process with the client. So they've signed the SOA already. You know you're talking Medicare Advantage. This will kind of go through some specific things about the plan coverage that they're picking. So we'll say when it's going into effective, if it's AEP 1/1, and what type of plan they're on, so they can kind of know a little bit more about the details of their plan, what their plan is, star ratings, stuff that you guys are knowing that you have to cover with them. This just gets it in a form where you can have it, the client can have it, and everyone's on the same page. Because if there's any premiums, any co-pays, you can put that on there. And then here is something that's amazing, is locking up what kind of providers or pharmacy information they have. This would be good for you to keep on your records and good for the client to know that at the time of this appointment, these were the providers you told me, this was the doctors you told me, because we know formularies can change. We want to make sure that their doctor is in network. That's going to be a huge thing. So having it written down at the time of appointment is a very nice touch here.
Yeah.
And then, as we know, the scope of appointment, we can start talking about a few other things. Not all of these things can be discussed at the time of this appointment, but looking through here as looking, so, you know, we can talk dental vision hearing, we can talk hospital indemnity, we can talk cancer insurance a little bit. I'll talk of a different webinar about how to do that specifically. But this kind of goes through and says, did you want to talk about it or did you decline this kind of coverage? I would suggest ones that you can't talk about during the scope of, or during that MA appointment, to leave blank. And so you can go through the ones you talked about, leave certain ones blank, and kind of set that expectation of the follow-up appointment. Like, well, I want to make sure we go through all of these today. CMS requires or does not allow me to talk about that. We can only talk about these things on the scope. However, I want to make sure you get your cards. I want to make sure you're all taken care of with your whatever benefits brought you to this plan, and we can talk about these other additional benefits at a later date. And then this has the client sign it, the agent sign it, so everyone can feel on board with the decision that you have made.
Yeah.
This is a great tool. We have one that's very similar for MedSups. I won't go through that, but here is a few other ones that on the website that you can go through for your appointments.
We do have a question here. Let's see.
I think we are here. Certification options in addition to AHIP. Yes, so some carriers won't require you to do AHIP. They might have their own certification process to go through in lieu of AHIP, but they'll have all the different certification user guides on each carrier.
Mhm. Is there a sheet like this for MedStop? Yep.
Mill, yes, there is. It's right here. So it's very similar. There's probably a couple different differences throughout it, but very similar. Work through it the exact same way, except you don't have to follow scope of appointment stuff. So
Right. Love. Can we customize these forms so I can put our own logo in and our colors?
That's a really good question. I will have to follow up with marketing on that. I know these are pre-made fillable documents, so I'm not exactly sure on the logistics of clicking through.
Oh, what am I doing?
It would be the
Yes.
summary.
Yes.
But I'll have to check with marketing on that because our AMP portfolio has stuff that you can do that with, your logo on there, your headshot on there. The colors aren't typically customizable, but it's worth asking. So I'll figure it out.
Yeah, so I think for this specific one, since it's on the toolkit and it's just supposed to be kind of quick grab easy, you probably won't be able to put your logo on this one or customize the colors just because we wanted to make this as easy as possible. So of course you can fill out all of your information right here. And then down here, you also want to make sure that you fill in those numbers and the disclaimer thing down there. So really this is more personalized rather than customized, if that makes sense, just because we want to make it super easy and quick for people to fill out. But that's a good question. If you're really interested in that, let us know and we can talk about that a little bit later. Good question though.
And Michael Murphy, how are I probably shouldn't have said last name, but love ya. Let's see. Where is the CYA form? I believe this is the one that you're thinking of. It has been kind of tweaked, so it might look a little different.
Might look a little different, yeah.
As you're going through here, you'll see very similar information. So I believe this is the CYA or cover your butt form that you are referring to.
Good question.
Is this like the new PECL form? I'm not going to lie to you, Gail. I'm not 100% sure what the PECL form is. If you type that out, let me know. I'll check on that for you. I'm not 100% sure what that is, though. Anna, let's see.
Any chance you have a list of all the carriers that require their own training and certification in addition to the AHIP?
Ooh, I do have a list. You're not going to like it. It's all of these.
Yeah.
So each of the carriers are going to have their own certification process in addition to requiring AHIP or NABIP or their own like home brewed version of that. So if you're offering Part C, Part D, there will be some type. It might be just clicking through, learning some different information and not necessarily a test, but there will be some kind of certification process. So yes, I have a list. It's just not very fun because it's all of them.
Insert crying emoji. Is what she said.
Yeah. Okay, so we will have them sign one and leave one with them. Oh, and referring to the summary form, I would suggest making a copy of it on your. If you have an iPhone, it's really easy to take a picture of it on your notes. I believe we have a video on that somewhere about taking a video on or picture on your notes. It saves it as a PDF. Then you can upload it to your CRM or your computer, wherever you're on there.
Yeah.
But I would recommend each of you having a copy.
For sure.
Because it is exactly that of wanting to make sure that at the time of this appointment, this is what everything looked like. These are the options that you declined. These are the ones we couldn't talk about. You kind of both have a lot better of a feeling of closure on the appointment once you're done with that.
Yes, absolutely.
Pre-enrollment checklist form. Oh, no. So this won't replace anything the carrier is recommending. I know exactly what you're talking about now, but no, this won't cover that. This is just kind of an addition to. I would still recommend going through your normal sales process with whatever the carrier you're working with, or whatever your normal process is. But look at something like this as something to, like I said, have that full closure of the appointment where everyone knows where we stood at the end of this appointment on this date. We signed it, we agreed to it. But setting that expectation for, I will be following up with you to make sure that your doctors are still in network, that your drugs are still going to be covered, because you can't really talk to them about OEP, but if anything changes, we all know that we have options to kind of work around to get their coverage taken care of.
For sure.
And ancillary products.
Yeah. Great questions.
Oh my gosh, you guys are amazing.
I know.
Okay, I said we're amazing. You guys are actually the ones that are amazing. So, okay, let's go down to the letters that you can send on or after October 1st. Right now, you'll see a list of nothing here. That is because, as we all know, there's new disclaimers that are coming out that will go into effect September 31st.
30th, I
Is there
think.
30 or 31 days? 30 days. I don't know.
Yeah.
The last day of September.
Last day of September.
So we're working right now with our compliance team, getting this information to CMS because these are marketing pieces that you'll be sending to your clients to get the proper disclaimers on there, to get the approval. So we wanted to make sure everything's on there. We pulled it just because we don't want you guys to send anything that's non-compliant that has our kind of stamp of approval on it.
We wanted to triple check like everything.
Exactly. So this will be here. There'll be different pieces about their ANOC and they're different colored. So I'll tell you about one of them. They'll be on here. So when you come back, it'll make sense. The ANOC letter will say, hey, this is your plan. Everything is kind of staying the same. You should have got this letter from the United Healthcare or whoever your carrier might be. It won't say a carrier name, but let's say that one's green. And then there's another letter that says the exact same thing and is red. That is something where a lot of our agents use that letter and send the green one to their carrier or to their clients that are going to stay on that same plan. Like, we know these benefits are the same. This should be a good plan for you unless something changed. And then send the red one to people that are in a service area that got reduced or are for sure going to need a different plan. Something's changed throughout the year that they let you know about that will say, all right, we really need to investigate what's going on here. Yeah. So when they call in or you call them and say, hey, did you get your ANOC from your carrier? Okay, cool. Did you get the letter from us? What color was it? This is something an admin person can do when they're setting those appointments for you. So they can know if it's green, they can tell them the spiel of everything's good. If you feel comfortable, we can come in, have everything double checked. Or if it's red, be like, okay, well, we really need to get you scheduled so we can look at your different options for this coming year. It's just an easy, nice form. You'll see it on here as soon as we get that approval.
This is a really great question. Can we send out scope of appointments now to our clients and have them send them back to us?
Sue, absolutely.
And we highly recommend it.
Yes.
Not only can you, we highly recommend that you start sending out scope of appointments right now.
Exactly. So scope of appointments are good for 12 months. So I would suggest going dentist style and having that client not leave the appointment without signing their next scope of appointment.
Yes.
So send them out now, have them sign them. And then at the end of the appointment, say, hey, well, we're needing to do this annually. I do want to follow up with you at the beginning of Q1. And then if you want, we can go ahead and take care of the paperwork. So next time we need to talk about this, it's already taken care of. Have them sign it. It's good for 12 months. If you miss that 12-month window, because you say, let's do them at the beginning of AEP, next year it's the end of AEP, you just have to collect another scope, but at least gives you the option to have that already taken care of.
Yes, absolutely. With that 48-hour rule, we for sure suggest go ahead and send them out now, just so that way there are no questions whatsoever if it's a compliant scope. So yeah.
Exactly. So here we go into the scope of appointment forms and CMS guidelines. So the scope of appointment forms, this one here is not the 2024. I'm going to throw that out there right now because, again, we're waiting on the most up-to-date generic scope of appointment. We look for one that doesn't have carrier branding on their scope. These are ones that are typically put out by carriers, but they just don't put their logo on it, so you guys can use it for everything. I'll go ahead and click on this here. You've probably seen these a bajillion times, but this was the scope of appointment that was more generic, had no branding on it. We'll get the 2024 one as soon as we get that from one of the carriers that doesn't have the logo on it.
Yeah.
So here goes into some CMS resources. So kind of goes into looking at the different communication guidelines as far as all the different rule changes have gone. I would highly recommend checking out, which day is Chaylin on?
Day 3, so that will be Thursday.
Day 3. Do not miss day 3. I'm sure a lot of you that are here today also attended webinars of Chaylin's in the past. The man is a genius. He knows so much about Medicare. He knows so much about compliance, being our compliance officer. but he's also super in tune to the industry and different things that are going on.
Absolutely.
So he can tell you what these things actually mean.
For sure.
Versus I could read you all the rules, tell you exactly what you need to do, but the guy has another level,
Right.
another gear. So definitely check out that day. But here it is in writing if you like to do your own research as well. Let's see. Perfect. Okay. Michael told me that's the one that they
That's
use.
nice. What is proper verbiage to use when telling a client why they need to sign a scope of appointment?
Ooh, it's a good question.
Yeah.
So I would lean into that this is a CMS regulated thing. The government, the CMS, actually requires me to have you sign the scope of appointment form to make sure that we're discussing the products that you want to discuss.
Mm-hmm. Yeah.
I would leave it that simple and let them know that it is a requirement that you as an agent have to do.
Yeah.
And
it's there to protect them.
Exactly. If they have any kind of pushback, be like, this is here to protect you, to only talk about the things that you want to talk about.
Yeah. Absolutely.
That's where I would leave it.
Yeah.
Okay, so here's some just information that CMS is putting out. You can find this all on cms.gov. However, here's another place that we've housed it for you so you can find those important resources. CMS landscape, I know, is something that everyone's always looking for to see what plans are going to be in their area. Here it is. This will take you directly to that landscape. I'll go ahead and click this here so you guys can remember what we're looking at. You'll start to see that here. We await like every single day going into, I believe it's in September. You'll see people checking their phones, waiting to see every single morning, did they update the CMS landscape?
And then there's a message, the landscapes are out.
So as soon as we see that, we're going to blast it everywhere and let you guys know it's updated. But just to get you familiar with, this is where that page will take you. Here's some more information on compliance and all things call recording, marketing material, all that information. Again, this is just another place to find it. Watch the video, webinar with Chaylin on there.
Yes, absolutely.
Let's see.
CMS has a scope of appointment cover sheet called Meeting with Agents One-on-One, and it's fantastic. It explains what the agent may and may not do, and I can email it to anyone. That's a really cool tool. I don't think we've heard of that. Yeah.
Send it to Ben. I know Ben and I talk quite a bit about you, Peggy, there. So I want to see that information. I would love to kind of get that information out. So thank you so much for sharing.
Yeah, that's awesome. I'm sending it to I'm telling the team about it right now.
Oh, yes. Sadie, when you're putting together your post webinar, maybe we'll throw that link on there since
Sure.
CMS.
Yeah, let's do it.
I saw Patricia said that she also would love to see that. So we're going to try to get that in the follow-up information.
Yeah.
Look at you, Peggy. Doing the good work.
Yeah, she said most people don't know about it. Yeah.
Judy asked, what's the CMS landscape all about? That is just going to show all of the available plans in an area. So you can filter through counties, states, all that specific information to see what plans are just available. These are not going to be listed by anything that you offer specifically, but this will show what is all available in a client's area. So kind of like what that disclaimer says is like, I'm not appointed to sell all the products, but I sell this number of these carriers. This will show all of the products available. So it will basically help you when you're looking at what plans to get familiar with, especially what supplies to order, because the H numbers will be on there as well. So you can say, well, hey, I know there was a good UHC HMO in my area, wherever it might be. That's a fair guess. So there's a solid UHC HMO. You can go then and see the H number and all the details on the plan, star ratings, everything. So then you can see where that H number is all available and you can order supplies for that, which I'll show you where to order supplies here in a second.
Yeah. It can be Judy, if you've never used the landscape, it can be a very overwhelming resource to use, but it's so incredible and there's nothing really out there like it. So if you want to learn more about it, please call us and we would love to run through it as much or as little as you want. But it's an excellent tool.
Yeah. I'm not going to go over these last two just in the sake of time so we can get through to a couple more resources. This has some product specific tools, a lot of different trainings, especially for the admin side of things.
So right there, this virtual admin training videos, that's where these recordings are going to go. So in a week from now, navigating carrier websites, utilizing senior marketing specialist resources, this video will be on the toolkit. To those watching the recording right now, you're on the toolkit. Welcome. Thank you.
We're from the past.
We're from the past.
Okay, so let's go back here. Anytime you need to go back to the main page, just click the logo on the top left. I'm going to show you one of my personal favorites that we won't dive as deep into as we did the AEP toolkit. AEP toolkit is just so important. There's so much in there that I want to make sure you guys see that. Not that any of these are less important. It's just the time of year what we're going to be working on the most. So my personal favorite thing, though, as many of you know, is I'll talk cancer insurance until I'm blue in the face. And we have now our Care Initiative page, which if you haven't heard about our Care Initiative, talk to me. Let's learn about it, because it's cancer insurance, awareness, resources, and education. So we're just trying to help make sure that you guys have all of the information, all of the training that you need to sell more cancer insurance. That's super important to us here. So this is also where our quote engine used to be. So don't panic. The quote engine is now down here. It's just a little tab versus its own little ribbon.
Yeah.
So let's hop into our Care Initiative page, which you'll see here. It talks about what CARE stands for, and each of these different blocks here goes into different resources we have available. So the Care Initiative, the C, cancer insurance, there'll be all the kind of product information on here. I will show you this one because we just talked to AEP Toolkit. It is built with a very similar kind of backing where it has kind of our recommended carriers for cancer insurance.
Love that.
And some more product specific details from that carrier on that. Awareness, this goes into our community awareness and involvement, but let's click on this one really fast because this is something that a lot of people probably wouldn't expect from their FMO. Is here's some events going on just in Missouri. We are always looking for more, so if you're in a state and you want to know about different cancer awareness events going on, let us know. However, you'll see some fun pictures of us doing our support. This is the thing I'm probably most proud of in the history of ever, is the foundations and charities. So this is different list of places that can offer some financial assistance to folks who have already had that cancer diagnosis. So instead of if somebody comes to you and says, well, hey, I have a cancer diagnosis, like what can you do for me for cancer insurance? We all know, unfortunately, the answer is not much. However, I wanted to make sure that we got some information about some financial assistance or different services that can be provided through these different foundations. So I highly encourage you checking this out. If you know anybody who has going through a diagnosis, go on here and see if any of them can help them out. Some of them are more regional specific. There are a few national ones. I will always vouch to the day I die about Cancer Care, who helped me out quite a bit. Okay, so sorry, I know, like I said, I will talk about this for days. Here's more resources that are available. So this is going to be more so for the marketing pieces, different things that you can leave behind with your clients, some mailers, different things like that we're working on. And here is our education. So all different things that you can go to learn more about cancer insurance.
Absolutely.
Okay.
Love this page.
So this is new. I love it. It's partially my baby, but marketing is amazing, putting this all together from just my scrambled thoughts. Okay. Let's say
Peggy said she
Peggy
just
sent that.
Thank
Awesome.
you.
Just emailed to Ben. Amazing.
Perfect.
Oh.
Love what you have done with the CARE program. Our experience is also that people buy cancer insurance because they now know someone, a friend, family member, spouse who has or who had or does have cancer. So yeah, for sure.
Yeah.
We want to make sure that we really care about cancer insurance, if you can't tell, here at Senior Marketing Specialists. So we want to make sure that we're helping our agents have the resources and tools to be able to help their clients out in every step of a cancer diagnosis or you know, a fear of having a cancer diagnosis. So.
And on that page, there is a place to put a request. It actually comes to me and my friend Gio. We'll talk with you about cancer insurance. I can give you a full AEP toolkit breakdown of this page, talk about products, all that stuff. There's a good place to request on there. All right, so next resource here is another banner. So we're still on our home page. Is just here's an easy way to access Medicare Center. I'm sure after this you will have this bookmarked. Please do it. But this will take you directly to the landing page where you can scroll down and get logged in to Medicare Center. So again, home page, Medicare Center, here's the login. I would bookmark this page right here. So you can skip through all the different clicking, but know that it is housed on our website. It's housed right there. And make sure that you have this. This will be for all your quoting, enrolling, call recording, everything that you're doing through Medicare Center. This link will get you to the right place.
We do have a recording of our most previous Medicare Center walkthrough webinar. We have a link for that, so we can put that in the follow-up email as well if you want a more in-depth walkthrough of Medicare Center.
Yeah, and if you're on the Medicare Center page here, you scroll down past that login, here's a bunch of different trainings we have on Medicare Center, Medicare app, and Lead Center. I didn't make Lead Center its own bullet point because I knew it was in here. So if you go here, click on Lead Center, it'll tell you a little bit more about that resource. Okay, we're moving right along. Thank you guys so much for the interactions. I love all of this. So let me read what I got here. Please send me your information on the Cancer Center.
Carol, that's what I'm writing down right now. We want to make sure we follow up with you on that.
I will get that to you right away. You let me know if it's not what you're looking for. I'll send you all the details of anything I've got though. All right, so moving right along, let's just pretend, oh, I just hopped on the AEP or it's during the AEP. I'm on SMS website. I need to figure out if somebody has a enrollment. So one, it's AEP. Of course they do.
Yeah.
Silly scenario, Clayton. This is now September and I have moved into the past. And you're wanting to look at what kind of enrollment does the client have coming up. We have this handy dandy election period assistant that you'll see down here at the bottom of the page. It's got its own little clicky box here. You click on this here. And what this is step by step taking you through exactly how to figure out if a client has or doesn't have an SEP. So this will kind of look at all the different factors. Won't go through each step here, but read the question out. Make sure you're picking an answer that makes sense to them. I'm just going to click through blindly some of these so we can get an answer on it. Okay, so this will tell you at the end is here's the election period you would use, and this is not valid for an MA only plan. So it'll tell you a little bit more details about the specific code or election that you'd be able to use. And if it doesn't feel right to you, start over. Answer it again, see if you're going between two answers, see if you go through. This is a good first check, but holler at us. We'll be happy to kind of walk through that situation with you and make sure that we're selecting the proper enrollment. Geo. Geo popped on here and said, this is my favorite tool, talking about the election period assistant.
Yeah.
I know Geo used to be one of you all out there selling insurance. So he used this tool all the time. He recommends it to all of our agents. And that's why I wanted to put it on there.
Yeah.
Shout out to you, Geo.
Absolutely.
All right, and I got a compliance question here. So quick pause. Let's see. Related to the 48-hour rule for scopes, if someone calls in and requests an appointment the next day, can we do that? It's not technically an unscheduled walk-in. If they're requesting an appointment. Okay, so here's where I get to be zero fun and say no. So that would be a scheduled appointment. It wouldn't be that walk-in. So my short answer is no, you would need to wait the 48 hours and kind of just explain to them that CMS kind of requires that we have a 48-hour break in between today and our appointment. Send them that scopable appointment so you can get that on the books really quick. The main caveat or asterisk to put on there would be if it's in, I believe it's the last 4 days of the enrollment period that they're in.
Not the month, but the last 4 days of an enrollment period.
Yes. So for AEP, you've got the last 4 days of that where the 48-hour rule goes out the window, get the scope signed, get them on there.
Yeah.
Yeah, no problem.
Please call me about cancer. Yep, I wrote down his name.
Awesome.
We'll get you, Milt.
Will do. All right. So election period, it's great. Check it out first. Live chat us, call us, whatever it might be. Remember, we could pop on here. I'm sure if I messaged them, they would give me a hard time because I've tried that. They won't answer my questions, but they'll answer yours.
Yeah.
Okay, so last couple bits of information. I'll get you guys out of here. These ones be quick, I promise. I don't promise. I talk a lot. I love this stuff. So one quick question.
Where was the SEP tool?
Oh, okay. Perfect. Anna, so we're here at the home page. Scroll all the way down, past the little banners of great pieces that anybody will need at all times. And then next to the quote engine is our election period assistant.
Mhm.
That's going to be the easy tool to try to help find SEPs before digging into all the nitty gritty of the carrier information.
Absolutely. Is there one other reason to make an exception to the 40, you said 45, but 48-hour rule other than the last 4 days of an election period?
Yes. The other exception would be is if that client does walk in.
A true walk-in.
A true walk-in. I wouldn't say, hey, yeah, no, come by tomorrow. I'll be in the office. Like, you're leading them to believe that they'll have an appointment during that time. This would need to be someone actually walks into your office and says, hey, I would like to have a Medicare Advantage plan. Help me, please.
And one thing I know that we've had, a lot of people say, well, I'm going to have a lot of walk-ins this year. There are going to be a lot of secret shoppers this year, from both carriers and CMS, which in the past few years, we haven't seen a ton of secret shoppers, especially from CMS, but this year you can 100% expect virtual secret shoppers, in-person secret shoppers, all around. So make sure that you're being as compliant as possible. That's one reason why we say if you have control over it, get those scopes signed now, so that way you don't have to worry about the 48-hour rule as much. You know that there's already a scope on hand that's signed and ready to go. But yeah, make sure that you're being very compliant this year. You're following the rules, as tough as it can be sometimes, to work around it, because you just want to make sure that you don't get secret shopped in, the one time that you pass up the rules. So,
and I will say, as long as you have the best intent in mind, compliance isn't as scary as it sounds. However, do follow the rules, do have the client's best interest in mind.
Yeah,
you're going to be all right.
Absolutely.
Oh, just some kind
Thanks,
words from
Mike. Yeah, that was very kind.
Okay, so let's say last couple things here. On our homepage, one of my favorite kind of slept on resources here is if you click over on our services tab, there's a lot of different stuff here. I'm not going to cover all of it, but check out our service tab here. Here is a quick way, I'm going to open this in a new tab, of getting, if it's after hours and you're wanting to get some information over to us about a situation, this will go directly to our agent resources team. So me and my team, here will be some information about different things that you might need help with. So fill out this. You can also email us the situation on here. This is just another way to quickly fill out this form. Let's say your admin staff doesn't have the same email access that you want them to. You can tell them to, hey, send this information here on this website. So good place to put some documents, tell them that you're not a robot, and then hit submit.
You have to tell our robot that you're not a robot.
Yeah, robots need to make sure that you're not a robot, but
they're very jealous, very competitive species. Is the 48-hour rule only for AEP for the scope of appointment?
No, it will go into effect on the last day of September. So going forward, this will be for 2024 plans going forward. So outside of AEP, you're still going to be having to do that rule. If it's a 2023 plan that falls outside or past that September 31st, 30th, somebody tell me how many days are in September.
I think it's the 30th. I could be crazy.
But the last day, if it's a 2023 effective that's past that, you will have to do the 48-hour scope of appointment.
It's 30.
30, okay.
Yeah, 30.
Thank you. I know a lot of stuff. Days of the month is not one of them. The purpose of a scope of appointment, is to protect the client. So this will kind of get them away from the predatory style of call centers that would say, let's get you on this plan. This got the best details. It's got the best everything. It's more time for the client to opt out of a sale. Scope of appointment just says, I want to talk about this and this. So they're not being oversold or talked to about stuff that they don't want.
Put on a plan that they don't realize they were put on.
Yeah. So this kind of highlights what they're doing with that. and then gives the client the 48 hours will give them more time to opt out of it.
Yeah.
It's just
So they
all
don't feel
about,
rushed.
exactly. It's all about letting the client feel taken care of and that they have enough time to make the proper decision.
And for the record, it also helps protect you because it helps keep documented and on record that yes, they signed this. I was allowed to talk about this stuff. So it's just a document that keeps your client safe from those who from the yucky people in the industry, and also keeps you safe from being accused of, you know, selling a plan that, you know, saying, hey, I did have permission to do this. So it's a good tool. It can be kind of, we know, like from an agent's perspective, it can be kind of annoying, especially with this 48-hour rule, but really it is there to help weed out the people in the industry that kind of give it a bad name.
A couple more quick questions here. 48-hour rule. If someone calls in to make an appointment and it isn't issued the scope, possibly, can we book a future appointment before scope is complete? Yes. So you can book the appointment. Yes, you can book that appointment, set that appointment with them, have them sign the scope. You just cannot talk about any plan details or anything part C or D until that appointment at that time.
So we have someone asking, what if they don't sign the scope? Then if they don't sign the scope, then you are not allowed to talk about anything MA or PDP whatsoever. So that's the thing. In order to talk about any products that are sponsored by CMS, you have to have that scope signed. If they decline, then you can only talk about Medicare supplements with them as well as other ancillary products. But MA and PDP is off the table.
Right. And if a client does wait until the last minute of their initial enrollment period, they do get that 4 days of the last bit of their enrollment period that they're looking at. So their initial enrollment period, if they've got 4 days or less remaining on that period, the 48-hour scope goes away. You still need a scope though.
Yes.
All right. So we've gone to the homepage. We've clicked on services. Now you're saying, Clayton, why is this so good? Here's different things that we have available on here. Lots of different stuff on here. Definitely scroll through, especially during fourth quarter if you're looking at different bonuses or contests going on with carriers. It's housed down there. Here's where you can click to order supplies. So if you're wanting physical supplies, you fill this form out. It will ask you all the required information. And if you don't know that H number, it will take you to the CMS landscape where you could find that H number. Fill it out to the best of your abilities. Give us a call if you're not 100% sure what you're doing. We can help get that placed for you as well. So what I love on here is the sales and marketing tools that we have available. This is where you'll see our different things like the MAPD toolkit, which you saw how that could assist you with sales, but it has a lot of different complementary products on here as well. So some different resources to assist you in your sales with hospital indemnity. The cancer plan sales toolkit actually takes you to our care initiative page now. We've got different things to help you with DSNP, final expense, all the different kind of things. And if you're preparing for some events during AEP or any time of the year, check this out. We've got some pre-built, what we call our seminars in a box. The presentation's already made for you. The slides are already made. You can just take that point or take it and run with it.
Yeah.
Okay. So I want to show you that bunch of different sales toolkits on here. If you're looking at ordering some swag for your agency before, I love recommending this page here. It will take you to some of the different things that you could possibly order. So ink pens will have a few different recommendations, stuff like that. So if you're looking at ordering some swag, start here, look elsewhere afterwards, which I feel like is a running theme with start with us. If we can't help you, ask us or we'll point you in the right direction.
Yes.
This is one of those that we don't personalize pins or folders, t-shirts for agents and stuff,
But we'll tell you who does.
we can point you in the right direction. Okay, last thing, I promise I almost hit the hour mark that I was hoping for, but let's go back to services. So homepage, services, or anytime in here, click services. If you scroll down a bit, you'll see one of my favorite people in our office, Deanna's favorite page, our onboarding tab. So this could feel like, well, I'm not on onboarding. I've been with you guys for a while. But why I like this is if you're taking a new carrier, you're kind of being onboarded with that carrier.
Yeah.
And check out this how to do business guides. So we send these out whenever you guys do take a new carrier with us. But let's say it's been a while and you just haven't used one of your carriers. click here. It will pull up a nice list of different carriers that we work with, not all of them, but some, and it'll kind of walk you through how to do business with that carrier. So I'll just click on ACE, for example, popular med sup, take a look at it if you haven't already, shameless plug. Going through this will tell you where you mail new business, how to get to their agent resource or agent services options. You can also call us, we can do that for you. Let us help you during AEP. Then different ways to submit business, stuff like that. So here's how to check commissions. All of the information that you might need is going to be housed on that how to do business guide.
So helpful. I love these resources that we make for people, because they're like literally what everybody wants whenever you take a new carrier. Okay, each one works differently. How do I do this? What's the number?
Right.
We have them right there for you.
Exactly.
Literally a step by step.
So when will this be available to watch? Sadie, that's you.
Yes, need my team members to watch this as soon as possible. Yes, of course, we love that. So Peggy, if you really need it earlier, call us and let us know, but it will be available next week on the AEP toolkit, and then we'll also be sending out the links with the follow-up email, probably on Friday or so, or Monday at the latest, so that way you have all the links to this. But definitely within the next week for sure. But if you need it a lot sooner than that, call me and I'll try to get it over to you.
Okay, here's my last 30 seconds for you guys, and I promise we're done. Different things to check out. News is going to have different blogs, different information about industry updates going on. There's also our annual, or not annual, monthly letter that gets sent out that's got a bunch of different resources on there. So you guys get that in your email, but if you're looking for news and updates, check out the news page. Products tab will go through and get you to different brochures, applications, stuff like that that you're going to need on a day-to-day basis. If it's not in the AEP toolkit, check out the products tab. It might be there. MA, we can't really put the apps because you have to be ready to sell. So that won't be there, but med subs, complementary products, you can find all that information there. Training, this takes you to Sadie's beautiful, beautiful website here of our Senior Marketing Specialist University. If you haven't checked it out, we can do an 8-hour webinar on it for you at a later date, but not today. There's so much information on here. Yeah. You've done amazing work with this. Services I showed you, events will tell you about future webinars going on. So during AEP, I know that slows down quite a bit.
But right now,
the
calendar's fully on. I'm tired. So be signing up for those webinars. We have at least 1 or 2 each week, basically through probably through the end of September. So yeah, make sure that you are jumping on and you are catching everything that we have on there. So
if you click on here, you can just learn a little bit about SMS. If this is not, or if we're not your current FMO, here's where we can show you the people, and the reason why a lot of people do want to work with us is because they want to go meet the team. And this is just me being me, and I'm taking longer than my 30 seconds to show you that I'm on here and I'm wearing a bow tie. It will load.
Come on.
Pow.
Hooray.
It's me. It's my bow tie.
Yeah.
So this is why a lot of people work with us as their FMO, is these wonderful humans on all of this team here. So check us out. Also, if you're not set up with us and you saw that bow tie and you're like, what? I want to get set up with that. Here you can go through and you can request a contract or meet with our team on outreach that could help get set up with us, so you have access to all of these resources. Full circle.
Awesome. Woohoo. So you guys, that's all we have for you. That's it. Not too much.
Not too much.
We didn't cover
just
too
nonstop
much.
Talk for an hour.
We didn't cover too much today, but yes, if anybody has any questions, you guys have been awesome, have asked so many questions throughout. We are, please feel free to ask the questions, throw them in the Q&A box. We'll be here for just a few more minutes, but thank you for sticking around for so long. We know that it's a lot of information. It's drinking out of a fire hydrant, but we want to make sure that you have all this info.
I know I've heard you say that before, but I love it every time.
Drinking out of a fire hydrant? Yeah, it's just too.
It's too much.
Helpful. But yes, that's why we have this.
I am thirsty, but this is a lot.
Correct. So yes, please feel free to call us and ask us any questions. 800-689-2800. That is our phone number. You will call in and get a human every time. So please feel free to, unless we're not here, then you get our voicemail. But
Ooh,
Yes.
and remember, during AEP, extended hours.
Yes.
So during
that's a good point.
AEP, we open at 7 Central, we close at 6 Central. So we've got not the full team, but we got a great little skeleton crew here that will be able to help answer the phones, help you out with those situations. So email us, call us, text us, do whatever it takes to get a hold of us, live chat, anything.
Yes.
We're love to help you guys. That's exactly what we're here for. Okay.
Yes, exactly. We're pumping up. We're prepping for AEP just like you guys because we're ready to answer those phones. Well, it doesn't look like we have any questions. So you guys, thank you so much again for all of the interaction. We absolutely love it. It makes our job a lot more fun.
Yeah.
And we know that you're getting more out of it. Tomorrow, we're talking about Medicare.gov. This is an incredible resource that if you know, you know. But we'll have Madison on here with us tomorrow from our Agent Resources team. And she's going to walk through a bunch of different resources on there that you might not know about. So please feel free to join us. And then the day after will be compliance, and the day after that will be carrier resources. So
there's honestly not a day that you should miss here. You might think you know everything about compliance. Chalon will quickly tell us that no, we don't know anything about it, and we're waiting for everything.
Absolutely.
Or he'll tell us exactly all the details.
Yes.
And like you said, Madison showing Medicare.gov is a very handy resource that we also use on Agent Resources every single day to try to kind of get answers in writing. And Ben just knocks out of the park showing all the different carrier resources. He teaches me new stuff about that almost every day also.
Yeah, absolutely. All righty, guys. Well, thank you so much for joining us. We will see you tomorrow. If not, if you're watching this recording, you can find the rest of the days on the AEP Toolkit. But thank you all so much. We will see you tomorrow.
Bye-bye.
See ya.